embrace biotechnology and diagnosis, harmonize salaries of health workers. They earn different salaries while doing the same job. Somebody else says there's a program called CAN HANDLE Afya for students. It was suspended because of fraud instead of punishing the fraud. Another one says advise her to solve UHC staff menace. They get only half salary for full work. Another one says Linda Mama must come back. That's what Mishi was saying. Another one says ensure SHIF covers ICU costs which are unaffordable by all Kenyans. Another one says, how will you handle monkeypox disease if you are confirmed? And you had answered that. Yes. Yes, Mule.
Chair, I didn't hear touch on the issue of diagnostic tools as recommended by the UN on the TB, HIV, and also supply of vaccines and drugs for malaria and the diagnostic tools for malaria. Please.
Yes, go ahead.
Yes.
The ones I've given you are just comments extracted from SMSs. Can you answer the members?
Thank you, Honorable Muli, for the question, and through you, Honorable Chair. Yes, this is an agenda that will also be priority in my list to be able to identify the situation and the gaps and the interventions therein. Regarding monkeypox, I'm happy to say that within this year, we've had multiple countries within the Afro region that have had monkeypox. And I have been part of the team that has been supporting the countries. And so I believe that this, with the support from the National Technical Working Group, we will be up to task to support the country to address monkeypox in terms of readiness and response in Kenya.
Daud, what was it?
Thank you, Mr. Speaker. I want to follow up what my colleague, Honorable Imase Mary, asked about facilities which have not been opened. A case in point would be even Meru, where there is a 5-story building which was done by Honorable Kiraito. He was the governor. 3 years down the road, it's never been opened, and there is congestion in Meru level 5. So there are many places like those. Do you think once you get in, you will say it is not national government, it is county government? What would your position be on those unopened facilities?
Take also from the Deputy Speaker.
Dr. Debra, also some concerns that have been raised by members of the public who sent me messages. They are saying that the community health promoters are being paid timely from the national government, but the contribution of the county governments comes in very late. I think they've been said that Isiolo County, they are currently on strike because they have not been paid. Nyamira County have not been paid for 9 months. So how will you ensure that the county governments are also able to make their payments as government does, national government does its contributions?
Yes, Owen.
Thank you very much, Speaker. Dr. Debra, just 2 quick questions. One, there has been worry of staff of NHIF transitioning to SHA or SHIF. They are worried about losing jobs. You know, we have a law that is in place, but they're worried. What is your take on this? Are you going to transit all of them? Are you going to ensure all of them have jobs, or others will lose jobs? This is a concern of NHIF staff. How do you respond to them? And secondly, what legislative proposals do you have to strengthen the health sector as you take over, if approved by this committee? Do you have any legislative proposal you want to make here? Because these are legislators and they will support your agenda. Do you have any legislative proposals going forward so that we can strengthen the health sector? Or what gaps are there in the law that you may want to fix to make health a better sector?
Go ahead and answer those.
Thank you very much, Honorable Owen. and for the questions that have been raised. So I will start with Honorable Dawood's question regarding facilities and their capacity. It is critical for us to monitor the capacity of healthcare facilities to ensure that they are up and running and they are offering quality services. And so it is critical that we conduct routine assessment to identify gaps and come up with intervention. I hope to work together with the county government in terms of identifying the gaps and supporting, because healthcare, the health system is not just the infrastructure itself. It is the commodities, it is the services, it's the human resource. So we need to look at all those things and ensure that our healthcare facilities are up and running, and that is a task that I would wish to take up and in consultation with the counties. Again, the community health promoters, indeed, they are a critical component and a pillar for health service delivery. They are the ones who go to the community, supporting preventive, promotive, and rehabilitative activities. And so discussions with the county government on the gaps as to why they are not, the community health promoters are not receiving their money is really important, and it will again be part of my agenda. Regarding the NHIF, I'm still new to the ministry. I will need to review the HR capacity, the number of human resource that is required for the new insurance, but an intervention can be too much and move the HR, depending on their roles and responsibility, to the new area. So again, this is an agenda that we can have with the technocrats to see where the gaps are and how we can move the NHIF, because it is very sad when, you know, the sole provider of a family loses their job. And so this is something that we need to support our NHIF staff.
Saying that the law that was actually passed in Parliament on the social health insurance and social health authority says that they will all be assessed, and if you have the skill set for the new system, you will be taken. So there is no guarantee. Don't set yourself up. When you get there, you'll get into trouble that you promise you'll hire them. They will be all reassessed, and if they are suitable, yes. If they are not, they will not be taken, because it was said that in NHIF, there are some people even who are geologists and yet they're working there, or nuclear scientists. So their skills don't match the work that they're doing.
Thank you, Honorable Chairman.
You will be the last.
Honorable Chairman, Kenyans have really been crying on the issue of public participation, and that there's so many decisions made in terms of Ministry of Health without their knowledge. My question to the nominee is, are you conversant with Article 232 of the Constitution on the values and principle of public service, and to what extent does your personal and work experience reflect these principles? I thank you, Honorable Chairman.
Yes, Majority Leader.
Thank you, Chairperson, Chairman.
Yes.
My last one, CS nominee. To me, you come across as a very young, diligent professional, but I have doubts in my mind. Will you be able to manage the cartels in Afya House? Because the home of cartels is Afya House. It was Christian Mafia House some time back. Do you have what it takes to fight the corruption cartels in Afya House, in NHIF, in KEMSA? Do you have what it takes?
Go ahead and answer.
Mr. Speaker,
yes.
I think we also need to be fair to our time and the nominee. That question has been asked several times, so we can't keep on repeating the same. So I think honourable members must be attentive.
Yeah, it was asked actually.
Speaker?
Yes.
Speaker?
Yes.
The question of the mafias and corruption was asked, but I think to be fair to the majority leader, he's asked about what he thinks in terms of demeanor. I think it is just more in her direct strategy. And even as you respond to that, I would tell you that the mafias always also say, we have seen many come and go, including the most recent one. So I think as much as that question has been asked, she can respond to it.
Isula is taking over my job.
Women power.
Let's take Raso. Let's not do another round. Raso, just you'll be the last. And the question being asked is very pertinent. It was asked before, as Amisi said, in fact, 2-3 times. Do you have the capacity, the ability, the will, and the strength to fight and resist the mafia at Afya House? That is the question.
To have thick skin.
Thank you very much, Honorable Chairman. Daktari, maybe mine is just one quick question. You have worked at WHO, and there's prescribed number of doctors per patient within a population. What is the standard, and how far are we as Kenyans? Because the UN says 1 policeman to 400 Kenyans. What do they say in terms of doctors, both at the national and the county level per population? Thank you, Honorable Chairman.
Debra, can you now quickly
answer those? Thank you, honorable members, for the questions. With regards to public participation, yes, this is a very pertinent issue of which I am passionate about. I believe there is need for community ownership. And what I see is that the highlight is the taxation of 2.75. We are not talking about accessible, affordable quality of care for all Kenyans, including the vulnerable and the ones with disability. So there's need for robust communication. We need to strengthen communication to the community so that they embrace and they own this initiative. We need to gather feedback and see how we can address the challenges. We need to look at the misinformation and counter it. We need to engage the community. And one of the people in the community that we can use are the community health promoters. And so I think that, or I believe that the risk communication, community engagement, addressing all these things is really a critical highlight before embarking on this journey. Regarding being able to manage the mafias.
You can't manage them, you confront them. That is what you have been asked. You eliminate them. So,
Honorable Chair.
Your colleague who came earlier said you neutralize them.
First of all, we can look